Hi everybody, it's Dr.Ho. We're at the Beyond Beautiful office, and today I'm going to demonstrate a Bellafill injection treatment. And Bellafill is the only 5-year filler on the market, and it really works differently from other fillers because it helps your skin to produce collagen over time, and that is how it fills, how it makes the skin look nice and smooth. And our patient Kim is going to be our subject, and I'll have her introduce herself and say a few words.
Hi, I'm Kim, 55 years old. I've never had Botox or Bellafill or fillers of any kind. So when Dr.Ho talked about the Bellafill that lasts 5 years and naturally makes your skin produce collagen, that sounded like a great option to help my eyes not look so tired, my skin be refreshed, and to minimize wrinkles. So I'm excited.
Yeah, I think it's a perfect patient. And as we zoom in, you'll see, I'll point out very common features under the eyes tend to get a little hollow, and the temples is another area that gets hollow. As we get older, the cheeks kind of pull away from up high in the face, and the lines, the smile lines get deeper, very common. And then because gravity wants to pull the tissues down, we tend to get jowls, and we lose that definition in our jawline. So I'm going to reestablish that and make that jawline sharper. Here on the chin, you can see some of those, we call them marionette lines, some of the fine lines too. So these are very common aging changes that a typical person sees as they get older. And so we will address those today with the Bellafill treatment. And I'm going to use a cannula. You'll see that a cannula is different than a needle because it's not sharp. It's basically a very tiny blunt-ended tube, and that's how I'm going to inject the Bellafill. You'll see it's very comfortable, and the nice thing about Bellafill is you don't get a lot of swelling. So right afterwards, Kim can resume her normal activities. There's always a chance of bruising, but with the cannula that's reduced quite a bit. I've already marked out, you see these little white dots, those are the areas that I'm going to use as my entry point. So I've already put some numbing medication in there, and from those points I'll be able to access pretty much most of her face. We'll demonstrate that here in just a moment. Please send any comments or questions while we're doing the Facebook Live, and we'll try to do our best to answer and address those for you. And we really appreciate you joining us today. All right, let's get started. We'll go ahead and get our cannula ready. So I'm going to start over here, just kind of the area that's under her eyes. The cannula is a great tool. It's one of my favorite little devices because it does such a wonderful job. And she's going to feel some pressure, but not a painful, sharp sensation at all. You can see just a little bit goes a long ways, and already we're getting some changes there. I'm going to work my way over to the side. And hit some of this hollow area that's commonly seen here to the side, the outer side of the eyelid area. And I'm going to extend that kind of towards her temple and help make that area a little bit fuller. So Kim, how are you doing so far?
Great, thank you.
What's your pain level?
Nothing.
No pain. Okay, so very comfortable.
Very.
Good. Again, she's feeling pressure. She's feeling things move, but it's not a sharp, severe pain of any sort. doing great here. We're just kind of moving along, filling in different areas that need more attention. Okay. You see what change we've had just so far. It already is making a difference. Now, I like to treat this area that's to the side of the cheek and help give kind of that higher cheekbone contour. And it helps to create more of a pleasing curve to the side of the face there. Excellent. Okay, we have the next one. And you can see already she's got better more improvement of that hollowness under her eyes. And there is a little bit of swelling, but that goes away. The nice thing, like I said, the Bellafill does not cause excessive swelling, which is great because it doesn't create much in terms of downtime. So I'm going to continue here. I've started at the upper part of the cheek and the temples, and I'm just going to kind of bring this area into the treatment zone as well. And with the cannula, we're minimizing any issues with bruising or other risk of damaging nerves and hitting blood vessels and so on. So it's a very safe technique. And we're going to massage this out here. But you can see already that's made that cheek contour very nice and more defined there. Okay. Right, let's go on the other side and do a similar amount. Here's that pressure she's going to feel, but nothing too uncomfortable. You can see how now that area under the eye is filled in. That's going to smooth things out. There's immediate improvement, as you can see, but also over time, as that collagen gets built up, that will help create even more improvement, more filling, and the results will be even that much better. So I'm just going to work my way and place it in areas that need more filling and that are a little hollow appearing, and that's where we're going to focus on. As you can see already, that's better. So it doesn't take a lot. Do we have any questions coming in yet? Any other comments and that?
We have a question from Randy Seals about how much this procedure costs and where you're located.
So thanks for your question, Randy. We're in the west side of Plano, right across from the Willow Bend Mall. And in terms of the cost of the procedure, it varies depending on how much product is used. So, for example, you can purchase purchase it by the syringe, each individual syringe, or it comes in a kit of 5 syringes. And the cost per syringe is a little bit more, and that's just under $1,000. I think it's $9.99. And if you buy a kit, you're going to save more. A kit of 5 syringes is just under $4,000. It's like $399.9. But there's a promotion that we're running, that if you buy that kit of 5, you get an extra syringe free. So you're getting 6 total syringes for just under $4,000. That, if you spread it across per syringe, is not that much different than a syringe of traditional HA filler. But the big advantage is this is going to last for 5+ years. And that's really the only filler on the market that can have that advantage.
And we also have another question from Brown Eyes, 33. They asked, "Is this not painful?"
Well, I'll let Kim describe it, or
No, it is not.
how would you? It looks worse than it feels. Probably is the best way to explain that. It looks like I'm pushing hard and so on, but in actuality, she can tell you it's not too uncomfortable.
It's like a little push here, a little tiny prick there, but nothing painful.
The only numbing medicine that I've put in is where I inserted my cannula, where you see the little white dots. I injected a little bit of numbing medication. So that's the only places that are numb, just at those spots. People also notice that it's less painful than other fillers that they've had, and that has to do with the neutral pH that Bellafill has, so it doesn't sting as much. But that's looking great. You can see already she's got a smoother look to the area here under her eyes. Her cheekbone has a little bit of a contour and more definition. Now I'm going to do a little bit here where the smile lines can get really deep as we get older. So we'll put some of this, get more collagen to come in there over the next few months. Kind of have the needle there. Sometimes, because these needle pokes are so tiny, the skin closes up, so I need to reinsert that so that my cannula goes in easier. These smile lines, or we call them the nasolabial folds, are a very common place that tends to deepen as we get older because the cheek tissue starts to push down, accentuating that line. So I'm going to re-support it and get that to smooth out and soften. And when we see her in the next few months, that will be a lot softer. Okay, the next one here. So just to recap, I placed the Bellafill under the eye, upper cheek area, the side of the cheek, the temples, the smile line. We'll finish up on that smile line, kind of work our way down from top to bottom. Any other questions out there coming in?
Not yet.
We encourage you to send in your questions, comments. We've got some great ones so far. what I'm going to address here is, we call this area the marionette line. This little indentation is the technical term is prejowl sulcus. It's just another term for indentation. So I'm gonna fill that out and make that smoother. Okay, turn this way for me. The comment or the question earlier about the pain level, I mean, this is her first time getting really any cosmetic injection treatments, but as you can see, she's very comfortable, and this is done easily right in the office setting. There, you can see how that's smoother now.
We have a couple more questions
Sure.
from Dennis. How is this procedure different from Sculptra?
So it's similar. It's a similar concept. Both stimulate collagen production, your own collagen. That's what gradually fills in. The difference is you'll see immediate results with the Bellafill, and it will last at least 5 years, where Sculptra is around 2 years. So those are the two main differences, but they both work by the concept of producing collagen.
We have another question from Yanina. Can Bellafill be reversed like Juvederm?
There is not a simple way to reverse it. It can be removed, but no, there's no enzyme or that sort of treatment that can reverse it.
And Michelle wants to know if there's any downtime with this procedure.
The downtime is very minimal. As I mentioned earlier, you may get a little swelling, you may have a little bruising, but that's about it. And I would say patients have less of that with this sort of injection because the Bellafill doesn't absorb water like some other fillers. You don't get a lot of swelling. And because I'm using a cannula, the chances of having any bruising, hitting a blood vessel or something like that is very low. And what I meant by that is you can see it's a blunt tip, so it's not going to hit a blood vessel and cause bruising to occur. Looking good.
And there's one more question. Will this smooth out around the lips?
It will, near the edge of the lips. Sometimes you get those lip lines that come off the edge of the lips. So you can place the Bellafill there and help with that. I don't inject in the body of the lip itself, where the red part of the lip, if you will, but to the edge we can. And it does a real beautiful job with that, which I know for a lot of people is a common issue. There. Right now I'm just trying to get a little bit higher up onto her marionette area, or kind of close to the corner of the mouth. That's just where I want to be. Okay, another one. So to summarize, we've treated underneath the eyes here, rounded out the cheekbone, filled out the temple region, and softened the smile lines and the marionette or the indentation here on the side of the chin. Next, I want to address the jawline and sharpen that, give a little more definition. So I'll demonstrate that for you. It's a very a very simple technique in my mind. I think it's something that can easily be done, and you'll see that difference right away. So we're going to turn this way and work from this direction here. Let's try to open that up again. Okay. So what I'm doing is layering the Bellafill along the jawline. And what that does is help give more definition to the edge or the border of the jaw. And over time, that gets better as that collagen comes in. You can already see that that jawline is sharpened up just from that little amount. So that's the beauty of it. You can see that improvement right away. Now I'm going to work my way up this way to get even more, a little sharper of an angle. Okay. You can see it goes in very easily, and this will help create some more tightness over time. That collagen is going to firm things up. So not only do you see those improvements right away, but you also see it continues to get better. This is where the jowl tends to be most prominent. So we don't want to add a lot of product in this area. We want to kind of stay away from that. And that's why I was injecting this way in the opposite direction. That's going to help pull and tighten that jowl. Okay. I think she needs just a little bit more right there. So we still, in terms of Kim, your pain level?
No pain.
No pain, she said, so that's a good answer. There. Can everybody see that? It's just a little tighter, a little more defined, and it's just the beginning, because that's going to get better. All right, now we're going to focus on the other side. It's looking great. Very good. This type of a treatment, like a lot of things, is customized. So someone may need a little, someone may need more. There's no one size fits all. And so when someone asks, how much do I need? We really need to have them come in person to get a full assessment. And that way I can figure out better what I think the amount would be necessary to try to get the results that we're wanting, that the patient wants. And just like everybody's different, the amount that they may need for their body will be different than the next person. There. Now you see that. There's a nice contour to it.
Here's another question. What do you use to numb the patient, and how long is numbing process take?
For Kim's situation, all I did was put a little dot of lidocaine. It's a very common numbing drug that we use in just about everything, and people probably had experience with it at the dentist's office, so same type of medication. And that's the only part that really stings, I guess would be the best way to describe it. Once that numbing medicine is in there, she's not going to feel anything. And that may last an hour or two. So it works great, it's very effective. There was no topical numbing cream needed.
Carolina wants to know, what are the signs towards the ends of 5 years after you've had the procedure? She's concerned about how the face will look once it's needed again.
Yeah, that's a great question. We can't stop the body from aging, but we're trying to maintain the best what we have. In this case, we're producing more collagen that we've lost over time. And so naturally, the collagen starts to dissipate, and the gravity that's still working against our bodies, pulling us down, that still happens. You get saggy and droopier and so on. So we can't keep that from happening forever. But she's not going to look worse, I guess is the best way to say it. Some of the pictures that I've seen from other doctors who have done this many years, the patients sometimes look better in 5, 7, or more years than when they first came in. So it is an ongoing process, just like everything else. You know, there's some maintenance. She may not need treatment where I've already treated her, but we want to address other aging changes that are going on. For example, the expression muscles. You know, when we frown or raise our forehead and squint our eyes, Bellafill doesn't fix that, so we still have to address that as well. It's not a magic bullet, it's not going to cure everything, but it definitely does make a huge difference in terms of restoring that lost collagen, some of that lost fullness that we see abundant in youthful looking faces. It's kind of the analogy of a grape turning into a raisin. You lose that nice plumpness. So that's what happens more or less. And we want to not have ourselves turn into a raisin. And the Bellafill will do a great job of keeping that fullness around for quite a while.
Michelle wants to know, do you recommend staying the night after the procedure, or can you just drive home?
Oh, you can drive home. There is no reason. It's almost like going in and getting your blood drawn. You know, you don't really think about it. But yeah, she's in perfect shape to drive, and she doesn't have any drugs that will alter her senses. It's strictly local numbing. So as soon as we're finished here, she'll be headed out and probably getting some lunch. Okay, so looking great. Can everybody get a good view of this? In a couple of weeks or so, we're going to show her before and after photos, so you'll be able to see the difference more closely. But I wanted to point out how much better her under eyes look. Her cheekbones have more contour to them. These lines are softened. This area is softened. Her jawline has more definition. And that's done with, how many syringes have we used so far? 6. So I've covered quite a bit of territory. She's looking great. I think I'm going to go back and fine-tune a couple areas a little bit more, and I'll show you that. And in this case, I'm going to use a needle because it allows me a little more precision. And so you kind of get to see both techniques. Can we load up this on there for me? Any other questions at the moment?
Yeah, there's one question. What's the difference between this and Juvederm?
So Juvederm is what we call a hyaluronic acid type of filler, or an HA filler. And it's completely different than Bellafill in the sense that an HA filler is basically a gel that gets slowly absorbed. So you're injecting a gel and it's taking space, then over time it's being dissolved by the body. The Bellafill, you inject it, you get some immediate filling improvement, but you also are causing the skin to produce or make collagen. And that's the key to keeping that longevity. And that's what makes the wrinkles go away. It fills in deep lines and makes the skin complexion look great. So you'll see when we show the before and after photos what a big difference that makes. And that's the key concept here is we're producing collagen, or we're stimulating her collagen production. So there's really nothing else really that can do it that effectively for that long of a period. So it's a really exciting product, and we're pleased and happy to be able to offer it for patients looking for a longer term solution. And as you can see, it's very natural. There's nothing very extreme about it. Okay. All right, so what I'm going to do now is just put a little bit more in these deeper folds. They need a little bit more product, and this time I'm using a needle, but even then, she's not too uncomfortable. Would you say, Kim?
No difference, I don't feel it.
Yeah, she's doing a little, there's a little hollow here, so I'm gonna, that needle allows me to go right in there, be a little more precise. And address that spot there. All right, I'm gonna do the same now on that side, but you can see how that small amount made a big difference. So even with a sharp needle, she still was very comfortable. So I think that's a big fear, that people have is it going to hurt? And as you are seeing right now, it's not a very uncomfortable procedure. Okay, looking good. Put a little bit more here in the pre-jowl. That will help her jawline look even that much more defined. Grab another, please. Okay. Now it's hard to see on her skin, but she's got some acne scars, and I'm going to treat those as well. It's a similar technique, but that's another use of this product that is really amazing. It makes those acne scars just about disappear, and the reason it does that is because that collagen comes in, takes up that space of any indentation, and smooths it out. See how here she's just got a little bit of a dip left, so I want to make that better. Excellent. Okay. All right. Let's. Can you switch me back to the cannula, please? Any other questions? Yeah, coming in.
Yanina says she looks great.
Yeah, she does. And
Thank you.
Kim's, she's been a trooper, so we're very grateful that she's helped us out today and, you know, is going to be our patient to demonstrate this on. I'm just checking to make sure everything's even. The great thing is there's no lumps or bumps to worry about. I see a couple spots here that I'm gonna do a little tweaking, so that won't take up much product at all.
We have another question. Can this be used on other kinds of scars that leave permanent indentations?
Yeah, basically any scar really that has a depression or indentation. I use it on surgical scars, even the ones that have, you know, from a long time ago, years ago, you can still use it in that case. So yes, any type of scar where you've got a little indentation would be an ideal use. I know this looks scary probably to most people because we're near the eye, but it's a very safe technique for the reasons I cited earlier. You know, I have a knowledge of the anatomy, so I know where I am, I know where to stay away from, and I'm using the cannula or the blunt miniature tube, and that keeps it from causing any issues there. It's an advanced technique. You know, obviously, you want someone who has a fair amount of experience of doing this, someone who understands the anatomy, understands how this treatment works, and making sure that you're a good candidate for it. So just that little amount helps even things out there. I don't know if that's noticeable, but it's a much better amount of fullness there. So I wanted to do a little bit more here, right in that area. A little goes a long way, so we don't need to overdo it. There. I think that was the perfect amount. And so how many syringes have we placed?
8.
8 syringes. That's a very typical amount. Again, how many syringes, how much you need is individualized. So someone may need a little bit, someone may need a lot. It depends on each person and what area we're focusing on. In this case, I've chosen to treat several areas: her eyes, cheeks, jawline, smile lines, chin. So I've covered a lot of area. Now someone else may come in and say, I just want something to help my under eyes, and in that case it would not need too much product to take care of that. So please, if you're interested, just call the office and come in for a consultation. I'll be happy to sit down and do a full evaluation to determine if this is a good treatment for you, and we can recommend more specifically the amount of product that you'll need. And please, even though we're going to finish up here, keep the questions coming in. We'll try to answer everybody's questions. And also stay tuned. In a couple of weeks, we'll post her before and after picture, so you'll see the result at that point. That's the exciting thing about this. You'll get the immediate change as you've seen, but also this gets better over time, and it can keep it looking good for at least 5 years, which Nowadays, there's not many things that do that. And we're really pleased about being able to offer this treatment to our patients. And we thank you for joining us. Thank you, Kim. Do you have any comments you might want to share with the viewers?
No pain.
Okay, so very comfortable.
Thank you for the opportunity.
Sure.
If you look them up online, you'll see nothing but incredible recommendations, so that's right.
Kim will kind of address some of the questions that may come in from her, so you're not going to get all of it just from us, but from the patient standpoint too, and from her perspective. So we appreciate you being our patient.
Thank you.
Thanks, everybody. Have a great day.